Let's discuss peritonitis, or inflammation of the peritoneum, which occurs when the membrane lining the abdominal cavity, called the peritoneum, becomes inflamed. Normally, the peritoneal cavity, also known as the abdominal cavity, is sterile and free of infection. However, when bacteria, gastric contents, or irritants enter the peritoneal cavity, an inflammatory response occurs. In peritonitis, the peritoneum becomes inflamed due to infection, perforation of the gastrointestinal tract, or trauma, leading to severe pain, fever, and a variety of other symptoms. If the inflammation progresses and is not treated, the patient can suffer from a septic reaction and go into septic shock. Periton refers to the peritoneum, or the lining of the abdominal cavity, and the suffix itis refers to inflammation. Patients experiencing peritonitis often present with severe diffuse abdominal pain, diffuse rebound tenderness, guarding, fever, and a rigid abdomen. One of the key words that can be used to describe the pain related to peritonitis is diffuse pain, meaning pain that is all over. Diffuse pain refers to pain that is spread out over a large area of the body, rather than being localized to one spot. Additional symptoms may include nausea, vomiting, tachycardia, and hypotension due to systemic infection. In severe cases, sepsis can develop, leading to multi-organ failure and death if not treated promptly. A key diagnostic feature of peritonitis is the diffuse or widespread abdominal pain, distinguishing it from other causes of abdominal pain that are usually localized. Here's a quick tip. Patients can experience peritonitis for several different reasons. However, one of the most common causes seen in EMS is in patients who are performing peritoneal dialysis. Peritoneal dialysis can commonly cause peritonitis because the procedure involves frequent catheter access to the peritoneal cavity, increasing the risk of bacterial contamination. This type of dialysis is often referred to as at-home dialysis. However, other common causes of peritonitis include perforation of the gastrointestinal tract, abdominal trauma or surgery, and intra-abdominal infections caused by a ruptured organ, like a ruptured appendix, or infections like pelvic inflammatory disease. To manage a patient with suspected peritonitis, provide supportive care and initiate rapid transport to the hospital. ALS providers may need to initiate IV access if the patient is septic or exhibiting signs of hypoperfusion. ALS providers may be able to administer other treatments such as pain meds, also called analgesics, as well. Here's a sample scenario related to peritonitis. A 50-year-old male presents with severe diffuse abdominal pain, fever, and want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.